Thank you, doctor. Now we will go to the next mail. The question is, does all patients with prostatic enlargement require treatment?
There is a common perception that any patient with enlarged prostate needs treatment. That's actually wrong perception. Thing is that the prostate is normally present in all males. Okay. It tends to enlarge by age. Okay. In some patients, it enlarges inside bladder. So what it produces outflow obstruction in a certain fraction of patients only. Not all males over 60 years have got this problem. Okay. Only a percentage, say 20 to 25% of patients will have this problem, because in that patients the prostate grows to inside the bladder, so it produces an active obstruction of urinary tract. So the mere increase in size of prostate doesn't mean that he needs treatment for benign prostatic hypertrophy. If patient has got any symptoms suggestive of benign prostatic hypertrophy, like I earlier said, like difficulty in urination, frequent urination, or sleep, broken sleep, and also urgency to void. If the patient has got these type of symptoms, which is suggestive of prostatic hypertrophy, then he has to be started on treatment for this problem. Otherwise, he don't need treatment. Like sometimes in our OPDs, some patient comes with an ultrasonogram report saying that there is, doctor, there is an enlarged prostate in my ultrasonogram done for another purpose. And if you inquire, he will not have any symptoms suggestive of benign prostatic hypertrophy. So in such patients, there is no need of treatment. There is only the symptom is the king. If the symptom is there and there is enlargement of prostate, you start treatment.
Okay. So is there any criticality in this enlargement?
Some patients can have these symptoms, but if they don't take treatment for a prolonged time, they can land up in urinary retention. That is, urine is not going out of their bladder. They can land up in emergency rooms with severe abdominal pain, abdominal distension and all. That's the only critical thing which can happen in course of a
treatment used for the critical situation is also the same?
No, in that situation we have to catheterize patient. That is, we have to put a tube inside bladder to drain the urine. This situation can happen in a course of treatment during benign prostatic hypertrophy, but normally with the good medical therapy available nowadays, the incidence of urinary retention is becoming very less.
Very less. Okay, thank you, doctor. Doctor, another mail is regarding what are the surgical modalities available for benign prostatic hypertrophy? Okay,
the surgical modalities available for prostatic hypertrophy are varied. Basically, we have two endourological surgeries in offering and one traditional open surgery in offering. First I will come to the open surgical method. Open surgical method is called open prostatectomy, which nowadays is obsolete almost. And I don't think any center in the world is doing right now open prostatectomy for benign prostatic hypertrophy. Because it has got high risk for bleeding and postoperative problems. Right now the gold standard is a surgery called transurethral resection of prostate. In this surgery, what we do is we grate off a large part of prostatic gland endourologically or using endoscopically. So there will be no hole after surgery. All surgery will be done through the native urethra. And postoperative stay will be very less for this surgery. And this surgery has got now an acceptable complication rates in safe hands. Another modality in offering is a very good modality and it's coming up very fast nowadays. It's called holmium laser enucleation of prostate.
That is something that's generally used?
That's not generally used, that's coming up. For the last 2 to 3 years, the scenario is like HOLIP is going to replace transurethral resection of prostate as the gold standard, most probably. In this surgery, what we do is we do enucleate prostatic lobes, prostatic gland using a special laser called holmium YAG laser. There is very least incidence of bleeding in this surgery. in this procedure. Also, the post-operative stay of the patient will be very less after this procedure.
Okay, so it's a safer.
It's a very safer modality, and we can do surgery even those patients who is on blood thinners. Some patients might be on blood thinners to not to have clot in heart or brain and all. Even those patients can adopt this modality.
Okay.
And it's very safe modality, and it's coming up very fast.
Okay, so you suggest probably that method?
I suggest whole membrane laser enucleation of prostate to all patients.
Okay. Thank you, doctor. That was a very informative segment from Dr. Sandeep Prabhakar. Please mail your queries to youthdiaryroseball@gmail.com. Please stay tuned for the next episode. Thank you.